Hello, my name is Loretta and I'm a healthcare innovator. My job is to bring together information from innovation and change theory, leadership, entrepreneurship, application technology, and system design programs to create innovative solutions to challenges in healthcare. Currently, in healthcare, it is a very difficult task to retrieve a patient's medical history from another facility. Patients and family members are sometimes forgetful or too ill to provide valid information for healthcare providers. This sometimes leads to delays in care, cause doctors to order repeated tests, and thus increase healthcare costs. A study done by Dartmouth College reveals that tests such as echocardiography, pulmonary function tests, endoscopy, and CT scans are all common repeated diagnostic tests. The study results indicate that among Medicare beneficiaries undergoing echocardiography, 55% of patients had a second test within 3 years. 49% of imaging stress tests were repeated in 3 years, as were 49% of pulmonary function tests, 46% of CT scans, and 35% of endoscopies. When people switch hospitals or doctors, the new doctor conducts his own testing. Some doctors have reported sometimes it's just easier to repeat tests than to find the old results. However, repeated tests has important implications for the capacity to serve new patients and the ability to contain healthcare costs. I think a more parallel electronic healthcare system could remedy the inconsistencies in patient medical history and decrease healthcare spending. I would like for you to invest in my idea of an easy and more efficient way to retrieve a patient's medical records that is interoperable throughout all healthcare facilities. I propose a health information exchange that has supportability where each organization can troubleshoot problems, reliability of the program that works quickly and behave predictably, interoperability where applications, data, and other components of the infrastructure are integrated easily, and security that allows healthcare organizations to protect the infrastructure. This will enable healthcare providers to quickly retrieve a patient's medical history and see what tests he's had done recently in the past few years, and the healthcare provider can diagnose easier and decide whether or not he should order more tests. Demonstrating a return of investment for electronic health record is challenging. However, a research study published in Health Affairs revealed that practices were able to cover the cost of electronic health care record in about 2.5 years and then receive about $23,000 per year per full-time employee in net benefits. The return of investment consisted of efficiency gains and increase in revenue. I'm suggesting that the improved quality and efficiency of care and the decrease in healthcare costs by my software application can potentially give the hospital a return of investment of about $25,000. The hospital can also see a return on investment from paper reduction. Legacy health systems have saved $279,000 in reduced paper consumption by centralizing files and reducing distribution lists. If we can easily retrieve records from other facilities, there would be no need to print or store files. According to healthit.gov, studies estimate the cost of purchasing and installing an electronic health record ranging from $15,000 to $70,000 per provider. Since the hospital has an existing electronic health record, I just need to add my software application to that program. Thus, there would be a reduction in cost. I'm asking for you to invest $30,000 in this project and help me help you save lives more efficiently. Thank you.